but I'm delighted to say we've got Nazia and Stephen and Rebecca and Lorna here now. Champion your services in your community. Come on then, you guys, it's over to you. Off you go. What are you going to say? Or would you like this as a facilitated conversation?
No, we've actually got a presentation, which I don't know if I can share, or I'm not sure if can be shared for us. I think Jade has it as well.
Have a go. See if you can share it.
See if I can share it. Oh, fab. Can you see it now?
Yes, we can.
Perfect. So we are going to go through some of the work that we're going to talk obviously about care within your community and working out why community connections and relationships are so important. We're going to go through a bit about some of the work that CareTech have been doing, and then drawing that in as well to some of the work that Championing Social Care has been doing across the country as well. So I'll start off and hand over straight off there to Lorna.
Perfect. I'm just going to flag up your hard stop on this. We're going to say 3:15, okay?
No worries.
Thank you very much. Off you go.
Thanks for that. My name is Lorna Fearon. I'm the Managing Director for Children's Residential Services for the Cambian Group, which is part of the CareTech organisation. Some of you may not be familiar with the group, but we do work in England, Scotland, Wales and internationally. And today, along with colleagues, we're going to talk about our responsible business strategy, which is Care4. And as Rebecca has already mentioned, in particular, focusing on the community aspect of that, and how that's had some real benefits for our children, adults and workforce, particularly across recent times of the pandemic, where, I'm sure colleagues have mentioned it across the afternoon, we have had a particularly stressful journey. So in effect, the Care4 approach brings in a number of factors, but it is about the organisation having a purpose-led approach to responsible business. It's looking at our values and what we want to embed, but essentially the outcomes and the outputs from Care4, which are heavily measured at group level, are a key success factor for the whole organisation. We want to be responsible, we want to really entrench and embed the values, and also we've been thinking a lot about the environmental impact of the work that we do at organisational level, but also at site level, and this has allowed us to have some measurement frameworks around that, and also look at how this impacts children, adults, workforce and communities. Okay, just to pop down. Thanks, Rebecca. So a key aspect of the Care4 strategy is how we work with the CareTech Foundation. So that was put together in 2017, and it's funded by CareTech PLC, donating 2.5% of pre-tax profits on an annual basis. And essentially that allows 4 separate funding pots that are live in operation across the foundation. So if we think about partnership grants, what we have offered is grants up to £250,000 to social enterprises, charities, businesses that have got similar ethics and values to us. And what that's allowed is some real qualitative research. One example is we provided a large grant to Birkbeck University to support a toddler lab for early research and assessment around autism. We've also provided funding to Bernardo's for a leave and care app, and done a lot of work with regards to the care leaving arena, providing employment pathways and mentorship for those young people who've had a vulnerable journey. Something that is really effective with our frontline staff and children is there's a lot of charitable work that takes place, and you probably see this in all organisations such as Macmillan Coffee Mornings, Race for Life, etc. And what the grant has provided is match fund. So if we've got a young person in a service that raises £100 through a Race for Life, then we'll match it to 200, and that just is a real incentive for people to do what they can for local and national charities. Community grants allows any member of our organisation to apply for a grant for a local enterprise. So we provided sensory equipment for small projects. We've helped places of worship have repairs. You know, there's a vast range of projects that's supported, but again, the impact that's had for us in the community has absolutely been of huge benefit. And finally, the staff hardship fund. We recognise that frontline care workers have sometimes faced some financial challenge, or the members of the family have. So there's a fund there to support tough circumstances, and you know, some examples of that have been applications for to support family funeral, for people to get overseas to see someone who's been unwell. You know, it's a broad range, and what I would say is the foundation usually approves those applications, which again has had a huge benefit to the workforce. You okay just to pop down, Rebecca? Thanks for that. So in terms of the foundation, what we're looking to do is, in terms of objectives, is to support children and adults with learning disabilities, physical disabilities and mental health needs. We have a key focus on developing skills in the care sector, in particularly looking at care as a career platform, and we've made some links with some universities just to look at the registered manager position in children adults, because actually that is not often deemed as a well-known career platform for particularly graduates coming out of university. So we want to do what we can with local university partners to really embrace and expose that career platform. And again, a key purpose of the foundation is supporting communities, particularly those communities in which we operate. We work with some very vulnerable children, and when we open services in a community, it's not always deemed positive development. And obviously we want to break that down and embrace the service and essentially be a good neighbour. Okay, just to pop down. So in terms of our strategic measures for community, we have a number of projects running. I won't go into detail of all of them, but what we have offered is a secondment programme to the foundation, so we can bring a diverse range of skills from across the organisation to support the specific initiatives. So for example, we've had a recent secondment to work specifically on Care Home Open Week, which Rebecca will talk about in a bit more depth in a few minutes. We have pulled social workers from the fostering organisation on secondment at their request to look at the issues and support needs around young people leaving the care system and what we can do to give some support and scaffolding around that transition. Engagement has been really significant for us in terms of listening to the voice of the workforce, and in effect it's you said we did. You know, we do want to embrace and embed organisational learning in terms of that feedback that we get from across the group. And we've also implemented an app called Mind of My Own, and that is just another engagement and consultation platform for children to share their voice, and that can be in a very safe way through the platform. In the next 12 months, we are focusing heavily on local sourcing. Like many organisations, we do some national purchasing, but we really are making a shift change to focus on commercially supporting small and medium-sized enterprises at site level and organisational level. And that is a big shift change, but we are committed to doing that for many value-based reasons. Care Home Open Week actually takes part next week. And you know, just to give some positive examples of you know, the work that's taken place within the communities, we've had one service put together a festival, and that's a young adult service with 5 males who have autism, and the benefit and engagement that they've had from that has been hugely positive, and it's really allowed members of the community to understand what we do, how we operate, and also have a stronger understanding of their needs, and how they can in effect support engagement around the service. Okay, just to move down, Rebecca. And just to conclude some of the activities, where we've had significant benefit is we've had young people in our services who've attended local football teams, rugby teams, youth initiatives, and the foundation has been able to provide new resources, kits, etc., sponsorship for those groups. We've contributed to play equipment, and an excessive, 7-figure contribution to support, match funding and joint initiatives across the organisation. Okay, so Rebecca will just talk a little bit more now about Care Home Open Week. You're on mute, Rebecca.
I've got some slides at the end that I've added. So if Stephen wants to do the Spark of Genius part, and then I can switch back in.
Sure, no problem. Thanks very much. So my name's Stephen McGhee. I'm the Managing Director at Spark of Genius. Spark of Genius is an organisation within the CareTech larger organisation. We have a joint venture agreement with Stockton Borough Council, which we call the Spark of Genius North East Joint Venture. So what is the joint venture and how does it fit into this community focus? It's a groundbreaking agreement between Stockton and Spark. In 2013, Stockton Borough Council had identified that they wanted to bring children and young people back into the local authority to improve their life opportunities, to keep them in the communities that they grew up in, to improve their links to local education. And also what it did was it improved opportunities for employment for people in the local area. So we were tasked with opening the operational running of 3 homes in a school, and over a period of a couple of years they were set up. The school initially had a roll of about 19 young people, and as of today is now at 90, and we have 15 young people, so 3 5-bed residential childcare homes in the Stockton area, and we're the local employer now of somewhere in the region of about 70, 80 different staff members. We have been able to integrate children and young people back into the community that in some instances may have been removed and sent further away because resources like this would not have been available. And that's been key in terms of their opportunities in the local community to keep ties with family and friends, and also to access some of the supports that maybe wouldn't be so readily available to them, like CAMS and some other, I suppose, health perspectives. One of the keys from a business sense is that the joint venture is a profit share. So when we charge the local authority for a care placement, at the end of the year, we split the profit that comes from that, and 50% of it goes back to the local authority. So the local authority benefit not just in a quality sense, but also in a financial sense. And I think Spark and CareTech see it as a very innovative approach to the challenge of some of the things that are going on around the promise, Josh McAllister's care review. So there's something to be taken away from that. In the short term, there were some community issues. As is often the case, there is a NIMBYism and some other issues that come when you set up local, especially residential care provisions. But what happened over a period of time was those residential services started to embed into the local communities, and they started to grow tentacles with local boxing clubs and gyms, and taking part in events with locals. They handed in issues they handed in different things to the local partnerships. So as a result of that, what happened was the residential homes started to become more embedded, and Red Plains in particular, one of our homes, has now achieved grades of outstanding, 3 inspections in a row, which is probably at the top end of residential care homes and how they operate across the UK. If you wouldn't mind just nick to the next slide for me. So as a result of that, Stockton Borough Council during the first wave had seen that this had gone particularly well, and they have made a future commitment to Spark of Genius and to CareTech. So they've made a £6 million commitment to expansion. And what that looks like is they are renovating the current school that we've got, and we're currently looking at options for an increased pupil role. So we've got a pupil role at the moment on site of 90 children and young people, but we're looking at potentially a separate school or schools to be able to meet the needs of local young people. We have entered into and won the tendering arrangement for a free school, which we are currently in the process of setting up, and it should be live in 2023. There is a commitment from Stockton Borough Council to new residential care homes, and we would be looking at opening certainly one that's similar to the profile of need of the young people that are in our current services, plus another one that may meet the needs of young people with things like autism spectrum disorder. And as a result of that, what we're hoping to see is a resultant uptick in local jobs for local people. So we feel that the project and the joint venture has been both financially, in a quality sense, and as a benefit for the community, a real success story. So that's probably the succinct way of describing the joint venture. Thank you.
Hi everyone, I'm Nazia Jones, the Service Director for Applied Care and Development. ACAD are also part of the CareTech group, and we have been for a number of years now. ACAD provides services across Scotland. We tend to work with children and young people with a range of complex needs. As you will be aware from the input provided by my colleagues, the need to demonstrate the contribution we make to communities has had an increasing focus over the recent years. We tend to achieve this in several ways. Firstly, the majority of residential childcare providers in Scotland are part of the Scotland Excel residential childcare framework. And what that basically means is that part of that framework, we contribute to community projects through the Community Benefits Clause. So this tends to operate through points being awarded to a local authority by Scotland Excel, and it's based on the level of spend that they have with a provider or providers. So these points do have a monetary value, and they can be used to fund community projects. So examples can be that the points can be used to fund a community project, a service, possibly more than an apprentice, or even recruit a member of staff. So over the past, I would say probably 15 years, we have had lots of projects, lots of ways in how we've actually contributed to the local community. In recent years, ACAD have funded the development of an indoor rock climbing wall, and this was very much done in partnership with the local authority. We were in the process of developing a youth and health and wellbeing centre, and they very much came to us and asked how could we contribute to that. So our young people came up with this creative idea that they thought a rock climbing wall would be a great way to really give something back to the local authority. And I'm really proud and pleased to say that it's been operating now for about 8-9 years, and it's still hugely successful. Our recent funding project was we developed a charitable organisation in one local authority. They were creating a drugs and alcohol centre, and we worked in partnership with them to create an actual group room, and that was very, very positively received. We've also had a number of community benefits, such as sponsoring the local youth football team, other community events, one of which was done in partnership with Children in Need. So these are just some of the examples of how we have contributed to this actual scheme. We also regularly invite local authority staff to join training programmes that we're currently running. Examples are, recently we've been running trauma-informed care practice training courses. We opened this up to the local authority, and a lot of their staff came and joined us. And this is also reciprocated by the local authority as well. So they had recently delivered a mental health first aid course. They'd asked for our organisation to come along, and again, it was very, very well received by ACAD. We also collaborate with local authorities, universities and colleges in terms of exchanging students. So an example would be that we accept students from the area local to our service and work placements. And we also liaise with the local social work services to enable our staff to experience statutory social work as part of college or university courses. We've developed some excellent working relationships with local communities and charitable organisations probably over the past 15 years. We encourage our children and young people to help give back to the communities. So within ACAD we have a participation group, and that consists of our young people, our staff and our managers as well. And it's really just a project where we encourage our young people, what can we do to give back to our local communities? And they have some creative ways on how we could give back. Our young people also help to make weekly donations to things like local food banks. We also include our young people in organising and participating in fundraising events, and the proceeds of which are then of course donated to a charity of their choice. So you can probably guess what the most popular charity tends to be. For our young people, it tends to be the animal charities. So they go along with their cheque and they donate, you know, great money, but they usually tend to come back with dogs, cats, lots of animals. So I think the last time we counted, I think we had something like 10 hamsters and quite a lot of dogs and everything. As long as our young people are happy, that's the main thing. And lastly, we also source and use local produce wherever possible as well. And this has really helped us to include the young people in how we source and produce and really support the local community businesses that we have. Thank you.
So I'll just do my bit right at the very end. So obviously we've had some great examples of different things that you, I guess, can do as a care operator to build connections with your community, and there are loads of benefits to that, and we see that a lot through Care Home Open Week. Obviously, you know, especially at the moment with the struggles we're seeing with recruitment, it's really important that, you know, we are present and existing within our neighbourhoods. But also I once had someone who accidentally, when they were having some work done to their physical building, damaged a neighbour's property, and because they knew the neighbour, they were able to resolve it really easily. So, you know, we're obviously doing those bigger things in order to build really positive relationships. But in terms of something, a great place to start, I would say a great place to start is with Care Home Open Week. It is next week, but I don't want that to put people off from participating, because there are still some ways you can get involved, and I'll share those with you in a moment. So Care Home Open Week is all about connecting communities, that we are aiming to obviously enrich the lives of UK care home residents, although all types of care can get involved. I know we spoke about adult services today, and children's services, and we've adapted the programme slightly in order to make sure that everyone is safe and cared for. So there's lots of ways that we can do that within your own care setting. The aim of the week is to show what your care home can offer, promote your facilities, activities and services, to showcase the career opportunities available in care, and to encourage greater community engagement. Care Home Open Week used to be Care Home Open Day, so people might have participated in that before. But you can head over onto the Championing Social Care website, and there are loads and loads of materials that you can use even after next week. We've got packs for letter writing activities with local schools. We've got materials for setting up like, you know, coffee mornings, afternoon teas, lots of things like that. Posters if you want to reach out to your local college and look at providing them with information on recruitment opportunities. There's loads of things that you can do to get involved and to make sure that your care service is really present within your community. And we've got so many things coming up next week. We've got over 100 MPs scheduled in to visit care homes. We've got work roundtables going on with the Department of Health and Social Care, and we've got over 1,500 different care services registered now, to open up to their community and to get them engaged and working on the on you know, coming together and supporting the people the services support, but also helping the businesses to find, you know, employees and volunteers as well. That was just a very, very quick run through. I tried to be super quick because I think John wanted us to very much be on time. I don't know if we've maybe got like a couple of minutes of questions, but if you want us to be quicker, John, you can just kick us off.
No, you've definitely got a couple of minutes for questions. I think the big question is, look, if people want to find out more about any of these initiatives, where do they go? How do they find out?
Yeah, absolutely. So Care Home Open Week, I can put a link in the chat so that people can go over. As I say, you can still register. It is happening next week, but even if it's just sharing on social media some things about your care service, just so more people are learning about different types of care, that's a really easy way that everyone could get involved. But there are loads of materials we've put together with schools and different community groups, so do make the most of those at any point. Don't feel that just if the week's passed you're not welcome to use them. You can head over especially onto the Greater Community Engagement and Volunteering page, and there's information about reaching out to schools and all sorts of different things there. And then I don't know, Stephen or Nazia, if you've got any way that people can reach out to you. I know if you're interested in the Foundation and Care For, that you can reach out to those guys for sure, but I don't know if you guys have anything else.
Yeah, if Stephen or Nazia want to put links to their work, or Lorna for that matter, but particularly Nazia and Stephen, if you've got links to your work you'd like to put in the chat, please do that, so that people on the call will be able to access it.
Oh, many apologies, just to join.
Thank you, Rebecca. That's come through.
No,
we've got to find out. Well, you've done it twice, actually. There we are.
I think I sent it to just you once.